All right.
So I think I'm pretty happy, especially in terms of where we've, done the transplant. So I think that's coming off really well, and I think like in the next 4-5 months it'll get even better, hopefully. So yeah, I just wanted to get your opinion, doctor.
I can see pretty well, and I also saw your pictures which you sent me.
Yeah. Okay, what's your opinion, doctor? Like, how do you reckon it's coming off well?
Yeah. So just to recapitulate, you are a 30-year-old person, no? Isn't it? And as we had...
I'm 31.
Yeah, I just saw the records, your previous records. Yeah. You had diffuse pattern alopecia. And we had discussed that diffuse pattern alopecia, you can have a result, definitely you can have a result, but you have to be on finastreide in the long term.
Yes.
So this is what was the plan, and you had agreed that you have grade 7 male pattern baldness, and the worst part is it is a diffuse pattern alopecia. Both things are a bad thing to have because it's extensive baldness, and at the same time you don't have any donor resource. Isn't it?
Sure.
So we had planned that we will use grafts around 3,000 and cover up the front, and at a second session we will do the crown area. And I think we have achieved our objectives. Even at the 7-month mark, it looks pretty dense, and there is still 2 months to go for full growth. 9 months is the time when full growth happens at your age.
Okay.
So I think it'll become even better. And as you are on a finastreide, you've got nothing to worry. And next session, we will do your crown with available around 2,000 grafts or whatever we have available. I think 2,000 is available. And we can also do some touch-ups and do your temple points this time. So that, because right now because you've got hair along the hairline, your forehead looks very broad in the horizontal dimension. Yeah, so since last time we didn't have much grafts, we wanted to do coverage first, achieve maximum coverage with available grafts. So now, this time we can do your temple points to aesthetically frame your face so that it gives you a youthful look. And also do the crown area with available grafts which we have mentioned in the case sheet. Okay?
Sure, okay.
And that can be done anytime after 6 months, so the time is ripe. It's up to you when you want to, when you find time. And when you get leave from your work and you can come over to India.
Sure.
Where are you placed now? Where are you based now?
I'm still in Sydney, doctor.
Sydney.
So,
okay.
Yes.
You're in Sydney.
So I'm not sure when I'll be coming next.
All right.
To India, but I definitely intend on coming next year.
So whenever. See the.
You're in Mumbai as well, right, doctor?
We are in Mumbai as well. Today we are in Mumbai also. So basically the most important work is done. So from the front you've got a very nice and pleasant hairline which looks pretty natural, no one can tell, and it's rather dense for a person who has diffuse pattern alopecia and who had grade 7 male pattern baldness. And now we just need to do touch-ups and cover the crown area. Yeah. So whenever you have the time, you can come over. And as far as the anything else you want to discuss?
Yes, doctor. So for now, as you can see, I mean, from the mid-scalp to the crown area, it looks a little weird because, this part has hair, doesn't, right?
Yeah.
So I was thinking using maybe Topic or some other hair fiber that can, sort of hide that.
Yeah. So
is that okay?
Yeah, till the time that you are not coming over to India for a hair transplant from Australia, from Sydney. So till then you can use hair fiber, and it'll do you a lot of good. It can easily be camouflaged, and it will blend very well with your rest of the scalp.
Right.
Yeah.
Right. And is it also okay to put the hair fibers on the transplanted area?
Yeah, no problem. No problem. After 6 weeks, after 1.5 months, you can put as many hair fibers as you wish. Okay. The good quality hair fibers are, as you know, Topic.
So I use Topic.
Yeah, Topic is very good. It is inert. Yeah, it is inert. It will not create any allergy, no allergic reaction, and it doesn't get washed off easily with sweat.
Right.
Yeah.
That's what I've observed, so which is great.
Yeah.
And doctor, so do you have any long-term implications of using hair fibers?
No, nothing at all. It's inert. It's inert. You know, these are very small pulverized particles of sheep wool, which are colored according to the various shades of hair. Yeah, so it is completely inert. There's no problem. You can use it as long as you wish. No problem at all.
Great. Okay.
Yeah.
Okay. That's good to know. That's good to know. Because I was just hesitant on using that because I did not know like what are the long-term implications and whether using it would create, more hair fall. So I'm kind of relieved to hear that, I can use it.
You can use it now.
long-term as well.
Yes, you can use it now.
Great. Another question I had, doctor, was with regards to the shampoo. So I am still using the baby shampoo, the Johnson & Johnson baby shampoo. Would you have any recommendations as to which, shampoo I should be using going forward?
See, you can use any volumizing protein-based shampoo, which is mild. Don't buy a professional shampoo from the salon. They are very strong shampoos and they do a lot of harm than good. So you use any shampoo which is volumizing shampoo. You can go to any mall, any store and ask them for volumizing shampoos.
Okay. And which should be like paraben-free and all the chemicals?
Yeah.
Right?
Yes, of course.
I didn't. Okay. And in terms of future medications, so I'm still on finasteride. I'll be continuing that for the next 6 months as well.
Yes.
I'm also taking biotin, doctor. I mean, it's not the same biotin that I got in India. It's a different one that I ordered online.
Yeah, that doesn't matter. See, you have to see that the biotin that a doctor dispenses is usually milligrams, 5 milligrams. And the ones you get in supplement stores is labeled as micrograms. So 5 milligram is equal to 5,000 micrograms. So just keep it in mind. Okay?
Yeah, that's the one I'm using as
Yeah.
well. And should I just continue using every
Yes,
day?
no, you can use every day. See, biotin is just a supplement. It makes your hair look little better. So why not get that benefit as well? It's not doing you any harm at all.
Sure.
Yeah.
Touchwood, no. I mean, touchwood has been, both finasteride and biotin has been okay. Like, I don't have any side effects, so which is good. And also, regarding the shampoo, doctor, should I wash every day or is it okay?
Alternate days. Yeah, as I had advised you earlier, you should wash it alternate days. You don't have to use Minoxidil.
Okay.
So alternate days, you can wash your hair and blow dry it at room temperature. So that it gives you maximum volume and maximum effect and the maximum illusion after hair transplant. You already have a very good illusion. You just have to maintain it and it will be fine for the rest of your life. Yes.
Right, okay. And you mentioned something about the oil, what's it called? Sorry, the oil.
Minoxidil.
No, Minoxidil.
Yeah.
Minoxidil. So did you say I don't have to use it the day I wash my hair?
Yeah, you can stop using it. If you wish, we can start you on oral Minoxidil. Because the thing why many people don't like using Minoxidil is firstly, it causes itching, flaking, and since it sensitizes the skin, it's a very uncomfortable feeling. And the result that is there, after all, hair transplant is done for your hair looking all full. It somehow diminishes the result after the hair is grown out by making the hair look limp and matted. Because it's after all an oily solution and it makes your hair look bad. So I'm not a very good proponent now, big proponent now of Minoxidil after the result is set in. So we can put you on Minoxidil, oral Minoxidil when you are here. Because oral Minoxidil, we put you on oral Minoxidil only after checking your cardiovascular status because it little bit lowers the blood pressure.
Okay.
Yeah.
Okay. Would there be, if I decide to continue using Minoxidil, the oily Minoxidil, I usually use it before I go to sleep and it's like overnight and I probably wash it in the morning. So
then it's fine. Then it's fine. See, if it doesn't take away from the result that you have, then there is no problem.
Okay.
Yeah.
Okay. Cool. I think because I do have a few bottles. When I was coming from India, doctor, I bought like 6 bottles.
So you can use it. Yeah, please use it. If you're comfortable with it, it's all right. If your routine, like applying it at night and washing it off in the morning, there's no problem there.
That's fine, right?
Yeah, that's
okay.
fine.
Okay. I guess those were the questions I had, doctor. But on and off, yeah, I do have a few questions which I just sent it on WhatsApp.
So whenever
Your team is very, very responsive.
Thank you.
Which is great.
Yeah.
Yeah.
All
So
right.
I think that's about it. Do you have any other comments, or would you suggest something?
Yeah, nothing else. Nothing else. That I just told you the plan that next time when you come to India, whenever next year,
Yeah.
we will make your temples look more aesthetic. The hair, forehead will look less broad in the horizontal dimension, and also we'll cover the crown area. That should put you in the proper direction for next about, I think, 7-8 years, and then if baldness evolves further, then we can do touch-ups. But I think more or less your procedure has gone well, and you should be able to maintain it with finasteride for a long term.
Great. Okay. Thanks, doctor. And sorry, one final question before I forget. In terms of the haircut, can I start getting haircuts on the transplanted area?
Yeah. There is no problem about haircut at all, but in hair transplant patients, you should not cut it very short. See, because it is 50% density, 50% in the front, and as you go back, it's about 30 to 40% density. So the moment you cut it less than 1.5 inch, the illusion of fullness may be lost.
Yeah. Okay.
And the same happens when you apply a gel. If your hair looks wet, the same thing will happen. So after hair transplant, certain things, restrictions are there, like not cutting your hair too short and not applying gel. Otherwise, you put shampoo and blow dry your hair at room temperature, you look perfectly fine if your hair is 1.5 inch long.
Sure. So you would recommend just getting the scissor and maybe just doing some trimming and not
Yes.
using the trimmer, right?
Yeah.
Okay. And that will be forever, doctor, or there will be a certain point where I can cut it really short.
Either you can shave it off completely, but if you cut it short, then there will be a little apparent loss in density to the eye, because the illusion is maintained when your hair is minimum 1 inch long. Because after all, it is not natural density. Yeah.
Got it. Okay. I'll try and keep it. Actually, I think this looks fine, this length.
Yeah, it looks very nice. If you keep your sides and back trimmed short and this mop of hair on the top, this is the current fashion.
That's what I do, doctor. So,
Yeah.
This is currently grown. You
Yeah.
kid face, and it looks good.
Yeah, that's the current fashion. Yeah, that looks very nice.
Great. Cool. Thank you
All right.
doctor, for your time.
All right.
If I have any further questions, I will definitely
Just drop a voice note. I'll send a voice note back to you in reply. All right.
Will do, doctor.
Okay.
Thank you so
Bye.
much. Take care.
Bye. Take care.
Bye.
You too. Bye.